Okay, so there was a question regarding the use of Apex Locators. This young lady is going to allow us to videotape how we take the measurements. Right now, we have done the initial part of the treatment. As you can see here in the monitor, we already have some working lengths or predetermined working lengths that Viviana has measured for us. So we already done part of the initial cleaning. We have used, like we show in our module on cleaning and shaping, we have gone in to 2/3 inside of the canal. We've used the wave. We've irrigated with our irrigants. Now what I'm going to do is, before I use the Apex Locator, I'm going to irrigate. I'm going to use my peroxide. I'm going to use my hypochlorite. Really close. And we are going to use alcohol in order to dehydrate the canals. Then very gently and very carefully, we're going to blow a bit of air, not directly into the canals, just a little bit on the side, just to dry things a bit. We don't need to necessarily dry things 100%. It doesn't make a difference with this Apex Locator. So now Viviana is going to get me the Apex Locator ready. So she's going to go ahead and tell the patient what we're doing.
Florence, right now we're going to use a device that is going to make some beeping sound. You will have a holder on your cheek under the rubber shield. This device is going to help Dr. Nahmias to find the length of your tooth, okay?
So we put the holder, the file holder, the lip holder, and now we're going to use a number 10.
1025. And
we have our Apex Locator is turned on and is ready to go. But before I'm going to use my files, I'm going to check to make sure that it works. So I'm going to touch the bow of the clamp. And when I'm touching the bow of the clamp, I'm going to make sure that I get this beeping sound here. And we can see on the reading how it's going all the way up. So we know our Apex Locator, everything is working properly. So the first canal that I'm going to measure is the Palatal Canal. She's giving me a number 10. 25, and she pre-estimated that this canal was going to be about 18 millimeters, correct?
Yes, that's correct.
So we're going to hook it up. We can see it going. So now we can look at the readout. We're at 0, 0. We're going to push it through, and we're going to bring it back. And we're going to set up our stopper right there. We're at 0, 0. We're going to push it. Pull it, push it. You want to show on the screen, please, Martha? So you can hear it. I don't even look at the readout. We pull it, we push it. We're going to make it there at 0, 0. Very good. And now we're going to measure. And we're going to measure with our ruler. And the palatal is measuring at 18. That's the electronic length. So Viviana was dead on, but since we like to take a millimeter off, our instruments are going to be set up at 17 for the palatal, and our patency file is going to go to 19. So we have the palatal. Now we're going to measure the distal buccal. So same thing. We're going to get ready. We're going to go into the distal buccal, and we're going to use the mesial buccal cusp as a reference point, or the distal buccal, depending which one is easiest for us. And we're going to go down, work our way down. Now if we find that we have an issue and we're not getting length, we're going to use a smaller file because the canal is very tight. So we're going to use a number 8 file instead of using a 10 file. So here we go. We're going to use the 10 file. And we can already hear it beeping. So we're at 0, 0. That's where we want to be, but we want to go past. So we're going to file a little bit here. A little bit of watch winding motion. If we have trouble, we can go back to our other instruments, the 21 millimeters, and use an 8 and a 10. But in this case, I think we're going to be okay. So you see, I'm past. I'm going to bring it back a bit. And that's my length. We're going to push to see, make sure that we're going through. We're going to pull it. And we're going to do it at 0, 0. And now I'm going to measure it. So I'm going to look at the measurement here. And the measurement is almost 20. So I'm going to tell Viviana that my length for the distal buckle is going to be 19. So she will repeat that to me.
Distal buckle 1919.
And now we are going to do the mesial buckle. We're going to do the same thing for the mesial buckle.
Yeah.
So let's see what our working length is in the mesial buckle. We only have 3 canals in this tooth. Again, you see, it's going through. The apex locator is telling me I'm going through. We go back, go through, we go back. And here I'm going to take the file out. And we're going to measure it again. And this one is about 18 and a half, so I'm going to go to 18. Now, Martha, I need you to tape here, so they see the readout. I'm going to do it again for the mesial buckle, so you see on the readout what it looks like for this apex locator. And this is my favorite apex locator. It works very, very well. And you see how consistent the readings are. So you see down, through, back. That's my length. Short. Perfect. And now we're going to measure it again to make sure that we're consistent. And it should be a little over 18. And if we look there, it's just a little over 18. Perfect. So I hope this little tutorial helps in order to understand how we work with our apex locators. And if you have any questions, please don't hesitate to post your questions. Thank you.